Good morning, pediatric partners, families, and patients. If you're old enough to be on Facebook and not in school today, maybe you're Zooming, I don't know. I am Dr. Jennifer Mellick with Pediatric Partners, and today is September 25th. I think today I am basically just kind of doing some of my random musings about COVID and some of the questions that we've had and what we've seen that has changed over the past couple of weeks. I think we always make a big deal about today is Friday, September 25th, and we do that because in the 6 months or so that we have been dealing with the COVID pandemic, there has been so many changes as to what has been going on. So I thought I'd talk a little bit about what we're seeing now that the kids have been back in school a little bit, at least with some of the kids in full-time school, some of them in hybrid, and what do you do if your child comes down with sick symptoms? If you guys have any questions, feel free to try to throw them out and across. I think I know how to answer them or see them. That being said, I very easily could turn this off and be done talking. I don't know, because I'm still a little bit challenged. So now that we've had the kids back in school, I've had a couple of families that have come in or called in and said that school has sent their child home because of symptoms that could be consistent with COVID, and that they cannot return until they have a doctor's note or a note from their physician's office or one of the nurse practitioners saying that they are safe to return to school. So that is kind of an interesting conundrum for us, because we do know that kids do get sick with other things. We are seeing this. We're seeing some strep again. We see strep every beginning of the school year because kids go back to school and they share their strep germs. We are starting to see some other viral infections coming out. And of course, it is fall season, so ragweed and mold are blooming, and we are seeing a lot of allergy symptoms, and we are seeing asthma type symptoms. And so for some people, this is their usual. So they go to school, they sneeze a bunch of times, they have a runny nose, and maybe they have a little cough and they get sent home. So when that happens, a lot of times the schools are rightly asking for them to have their physician's office clear them to return to school, because we do want to make sure that we are doing our best to limit the spread. I'm not saying that we're going to completely prevent it, and we're not going to get it to zero. That's not the goal, but we do want to make sure that we're trying to limit the spread of COVID so that we are not infecting those who are at most risk. Our problem is that we just can't clear these kids over the phone. We just can't. And it's not that we don't trust the parents, and it's not that we don't believe that the kid has allergies or that this is their typical thing that happens every year. It's just that they could have allergies and have COVID. Let me tell you a little story. I know of a young lady who has pretty significant allergies. Fall, late summer, early fall is always a really rough time for her. And I happen to know that every year this time, she tends to get a little bit higher congestion. She usually sneezes a little bit more. Her asthma sometimes flares. So she had been outdoors a lot in the days preceding the beginning of this story. And I happened to speak to her on the phone and noted, "Wow, you sound a little congested." And the answer was, "Oh yeah, at this time of year I always get a little bit congested." And so we talked a little bit about making sure that this particular young lady was following her asthma action plan, and we bumped it up into the yellow zone like we typically do this time of year, and didn't have any other symptoms. This was on a Sunday. There was no fever, no headache, just a little bit of congestion and a little bit of a cough, which is typical asthma for this young lady. So fast forward a couple of days, and at that point, no known exposure, of course, to COVID. So fast forward a couple of days, and I think that Tuesday, the symptoms were still congestion. Now, headache and fatigue and not feeling good. And it came to pass that we learned that there was now an exposure. That was a couple of days before that. Well, we swabbed this young patient or this young lady, and she is positive for COVID. So we can't just assume that even though you have allergies this time of year that it is not COVID. So for us to be able to clear you and give you a note, that may mean that you are going to have to bring your child in, have us do an exam, and have us do a test so that we can safely, in good conscience, say this isn't COVID and send you back to school. The other thing that I would like to say is that we do know that kids get strep a lot this time of year, and strep will give you fever and will give you sore throat and will give you body aches, and these are things that can be consistent with COVID. I want to caution all of you watching, and my patients and their families particularly, to please use a discerning eye when you are maybe having your children or yourselves seen at an outside urgent care. There is no provider that is so good that they can look and say, that is strep, here is your antibiotic, without doing a test. It's not possible. There have been studies after studies after studies looking at the provider, looking at a throat, doing an exam on a patient, and then swabbing. And before they have a result, guessing or predicting, is this strep or is this not strep? Anybody want to know about what the percentage is of being accurate on that? And this is a intelligent, seasoned provider. You want to guess what it is? 50%. So we're as good as a coin toss. So anybody who says, oh, this is strep, but doesn't swab and just says it's strep and it's not COVID, I'm sorry, they are not practicing good healthcare. That's just the long and short of it. So if that's where you're going, think about going and seeing somebody else, because you're basically not, you're getting mincemeat and they're packaging it as steak, and it's not the same thing. So the other thing I would say is that it is, like I said, possible to have two different things at the same time. So please be kind to us and be kind to my staff when they say, I'm sorry, we can't just write a note. You're going to have to bring your child in. So that's kind of the what do you do if your kid gets sent home, or if your kid has symptoms. Even if they are not exposed right now, those of us who are living in the Johnson County area, we still have fairly high community rates and spread. So, I mean, you could get it by, going to the store. So we have to be cautious with this. Okay, something else interesting that just changed as of, I think, the 18th or the 20th. We used to say that unless the person who was exposed has symptoms themselves, they do not need a test. Well, this has now changed. The CDC is recommending that if a person has direct known exposure to COVID, and not just I passed by somebody and then I heard that they were COVID, but an actual exposure to COVID. So that means they were within 6 feet of the person for 15 minutes or more. That's CDC guidelines, although I think that there are some health departments and some school districts that it's a little bit different. But if they are considered to have an exposure, we are now recommended to test them. So the big question is, when do we test them? The consensus right now, and this may change, again, today is September 25th, but this may change, is probably about 5 to 7 days or so after the known exposure, because it's not like you're gonna say, hi, how are you, nice to meet you, have a conversation, and then that person's positive and same day you get tested and you're positive even if you weren't positive before. Does that make sense? I'm sorry, I'm kind of rambling around, but the idea is we want to give you time to convert to being able to have an accurate test, so probably 5 to 7 days. The other thing to know, though, is a negative test at 5 to 7 days is not going to change the quarantine recommendation. If you have exposure, you are supposed to quarantine for 14 days right now, according to CDC guidelines, from last exposure. So this makes households a little bit challenging. So let's say you live in a household with 3 children, and one of them comes home and had been exposed at school for whatever reason, and they have a cough, a new cough and congestion, and they are tested, but you guys are still living in the household in the same manner that you are. You have not isolated them in their room. You are not asking them to wear a mask in their home. You're not wearing a mask in your home. And they get tested on a Tuesday, but they don't test positive until that Thursday or Friday. Well, if you've continued to be around them, you then have to, and they become positive, you have to go into isolation from 14 days from your last exposure, which in this scenario would be Friday. So if you think your child or somebody that you are in close contact with frequently potentially has COVID and you're awaiting confirmation or a test, it may be worth having them go ahead and go into isolation and you guys not have what would be considered a direct exposure. If possible, of course, please feed your children, okay? I mean, that's not what I'm asking you guys not to do, is just stick them in a room and, you know, toss fruit snacks at them or anything. But you have to take care of your kids. But if you have the option, let's say a husband or an adult child is capable of staying in their room and you delivering food outside the room to them and they have their own separate bathroom, you could cut down your quarantine time if they do end up becoming positive. So it's a little bit different with the guidelines right now, but we are recommending some testing for asymptomatic exposed people. I don't know if that'll change, and that will obviously be limited by our testing capabilities because we are going to have to reserve testing for those that need it most, and that would be the symptomatic. Right now at my practice, we are not having any limitation on our testing, so it is capable. You are capable, if you have been exposed or your child has been exposed, to get them tested in our office. Okay, I kind of mentioned a little bit about asthma already. Asthma is something that we see flare a lot this time of year just because allergy season, with the fall allergy season, is kind of high right now. Ragweed is higher, and it tends to flare people who are allergically induced with their asthma. This is going to present some challenges with kids who wheeze and asthmatic patients and what we do with them in our office. The nebulized treatments, that's the machine that blows the stuff at you, is going to be considered something that increases risk of spread because it generates droplets that can hang in the air for a period of time. And if your child or a patient has COVID and they get that procedure, then that places the other people that are in that room at higher risk. So we are really going to be limiting, if doing at all, any nebulized treatments. And so parents are going to be saying, if you have a child who has asthma, well, that always works better. Well, no, it really doesn't. The inhalers will work as well when you give equivalent doses. I think I said this on a previous Facebook Live, and if this is all the same information for you guys, again, I'm sorry, but we keep getting these questions, so we're going to answer them again anyway. The inhalers, the puffers, whatever you want to call them, they have the same medication in them that we give in that nebulizer, or that machine that blows kind of air and that's nebulized or puffy air. Some people say it looks like smoke. It's not smoke. We're not giving your kids smoke, but it has the same medication in it. It just has different doses. So the equivalent dose in puffs or inhalations of your inhaler is 8. And it depends on your ability to do it. So spacers or tubes are very helpful to make sure you get the medication to the appropriate part of the lungs in order to give the best effect with an inhaler. So this is a time that if you guys have kids who are asthmatic, go ahead and do a follow-up right now. we can update their asthma action plan. We can make sure they have their inhalers. We can make sure they have a spacer. We can make sure that they are able to take care of this at home. I also mentioned that allergies are pretty bad. And I know sometimes parents and kids are hesitant to take medications unless they really need it. Well, if you tend to be a person who has allergies this time of year, maybe don't wait for symptoms to start. Maybe go ahead and take your allergy medication like your Zyrtec, your Claritin, your Allegra. Maybe start your nasal sprays, your Flonase, your Nasonex, Nasocorts, any of those types of things preemptively, in order to avoid the, is this my allergies or is this COVID, right? I mean, these medicines are safe, they're effective. So go ahead and have a preventative game plan as opposed to a reactive game plan, because it may save you that trip to our office, because if they really do just have congestion because of their allergies, you guys aren't going to have to come in and have us take a look and do a swab, because hopefully their allergies will stay under control. Lastly, I think the other thing that I wanted to talk a little bit about is the flu season upcoming. Flu typically hits in this area of the world between about November and February. Sometimes our season is as early as, I've seen it as early as August, September. Sometimes it's as late as March, April, but typically it is going to be between about November, December usually, and February. So we are really recommending getting flu vaccines this year. Number one, it is going to help prevent the is this flu, because flu vaccines, while not 100% effective, are very effective. Even if they don't completely prevent symptoms, they definitely prevent the serious illnesses, the morbidity, like the secondary pneumonias and the other complications that can come with flu, ear infections, throat infections, asthma flare-ups, and they also do prevent the mortality or the death from the flu. So getting your flu vaccine is going to be helpful, because now I maybe am going to have less is this flu, is this COVID. I don't have a COVID vaccine yet. I know it's being worked on, but we don't have anything that's effective that we can say, please get your COVID vaccine. So definitely get your flu vaccine. I've had a couple of families ask me, well, are you sure it's safe to get it during COVID? Yes, I am. I am sure it's safe. We are sure it's safe. It is safe every year. Is it going to be 100% effective? Nope, probably not. But what would really be bad is flu and COVID. I just cannot imagine how a poor body would be able to tolerate that in the way to have to try to fight two different things. So get your flu vaccines. It's safe to come into our office. We are keeping those patients who have high suspicion of COVID out of our offices by doing telehealth, which we still do have, and then they are able to drive up and have a COVID swab out in the parking lot in their cars. We come to you, so we'll help set that up. So those are kind of the big things that I wanted to talk about. I know I'm not quite as chatty today as usual, but there's not a lot of new information. I'm sure there will be, and hopefully we will continue to see what we have seen. And there is some cause for hope that even those kids who are getting COVID, they are doing well. They're not terribly sick, most of them. That doesn't mean that we know for certain that there's going to be no long-term complications. So I am not by any way suggesting, oh, let's just have COVID parties and see if we can't all get it and get over it. But we are not seeing the levels of hospitalizations in children that we were concerned we maybe would see back in March and April. We are not seeing those kids who are getting very sick. Many of them just get mild illness and get over it fairly quickly. So that's great, but that is not the same for those that are older and that have comorbidities. So a good level of infection control is still going to be recommended and the best course of action. The other thing that I would mention is that there is risk for kids included to have some complications that will likely be rare, but can include things like inflammation of the heart, the lungs, and the kidneys. And so we are seeing some recommendations that there may need to be some clearance in athletes, particularly who have had COVID, to make sure that they are safe to return to their sport, and to give them some guidelines of things to watch for as they do a return to play protocol, similar to a return to play protocol after concussion, to make sure that they are able to rejoin their teammates in their sport as safely as possible. So this is a lot of different moving parts. What age is the child? What level of athlete are they? How sick were they with COVID? So if your child has had COVID and they are an athlete, it really does probably warrant at least some consideration as to whether they need some clearance once they've recovered from COVID to get them safely back to their sport. All right, well, I didn't see any questions come across, but I did see some of my friends watching, so hello, thank you. I hope everyone is staying well, and of course we are here for you if you need anything, but be well and enjoy the weather that we're having right now. All right, take care.